I'm Sam Clark. Hello, welcome. I'm from Learning Disability England, and I've got the job of trying to make sure that the webinar works. Can I have the next slide, please? And I am here with my three colleagues, Christiana, Tricia, and Marie. Now, Christiana and Tricia are going to introduce themselves when they do their bits. Marie, you can see on the screen now, she's the one waving, yes, but she's mostly here to help us with the Q&A. So you might not hear a lot from Marie, and if she's here helping and she's here listening. So we are today wanting, can I have the next slide, please?
Sorry.
So today we are here to talk about annual health checks. And just as we were preparing for this today, I think it was Christy said, should we just say to people what we think an annual health check is? And I thought, oh, great point. So we think an annual health check is what we call a particular visit or exercise that has been designed to help people with learning disabilities look at their health in the round. So it's about checking in on how somebody is doing, looking at basic kind of health check stuff like, you know, what's your blood pressure like, that kind of stuff. It's often done with a nurse or a doctor or both. And so that's what we are thinking about. And it was introduced because we know that people with learning disabilities often have worse health experiences than non-disabled people. So that's what we think. Anyway, I've probably said it really badly, and there'll be some of you on here who say it much better than me, forgive me. So what we want to do with today's webinar is we want to tell you about a piece of work we've been doing, about looking at what the workforce is, implications are around annual health checks and what people knew. And Chrissy will explain that to you in a second. We want to share with you what we found out works and helps people have annual health checks. We want to share what we've learned recently about health checks and coronavirus or COVID-19. And we're going to share with you resources, things that people are trying, anything we can by the end of this session. Also at the end of the session, we are going to ask you what else you think might be helpful. So we hope it's useful. We hope it's interesting, and you will get an email very soon afterwards asking what else might be useful and what feedback. And I'll remind you of that again. But yeah, I'm going to hand over to Christiana now, who's going to tell us about the project.
Thanks, Sam. Hello, everybody. Good afternoon. My name is Christiana Evans, and I work for Skills for Care. I am a locality manager specifically for the Southwest, but I'm part of the wider learning disability and autism team at Skills for Care as well. So last year, we put this project group together that consisted of 4 organisations, and that was us, that was my Skills for Care, that was the National Development Team for Inclusion, or many of you might know it as NDTI, Learning Disability England, and VODG, which is a voluntary organisation disability group. So we formed this partnership, and we got some funding from the Health Education Southwest to look into the take-up of annual health checks across the Southwest and Southeast, and then the project was expanded to include London. So currently, evidence shows that only about 53% of people with learning disabilities are having their annual health checks. So the project included sort of 3 parts to it, really. First of all, looking at doing the survey. So that was a scoping phase, looking at the number of, or just putting out a survey to ask about people's experience of annual health checks, what the barriers might be, what the facilitators are, and then that was followed by a number of focus groups throughout, which include discussions, smaller group discussions, to get a bit of the detail and the narrative behind the survey results. So that's already taken place. And the second part of the project was more about intervention and evaluation. So that was interpreting the survey results and the findings from the focus groups, and then mapping what resources are already out there and looking at examples where the uptake of annual health checks are high. So looking for good practice out there, and then creating any new resources if appropriate. And then the final part of the project was dissemination, which is the sort of the bit that we're in now. And so that's again more focus groups and discussions and events to share our findings and the information on what resources are out there and the data that we've discovered. And this webinar today is part of that activity. So we've been very surprised at the uptake of today's webinar, which is really, really encouraging. And so as Sam said, what we want to do is you will all be sent the slides as well, by the way. And we'll be sending out a very, very short SurveyMonkey link to SurveyMonkey after this, which we would really appreciate if you could take the time to fill that in, because then that will inform what we do next and to find out whether or not, you know, if today was useful. So can I have the next slide, please? So who completed the survey? We devised a number of different versions of the survey, one for people with a learning disability and or for their family member or carer to complete with them, one for social care and health staff, one for GPs, and then we had the other category, which included people like commissioners from CCGs, local authorities, and anything else. So the survey asked questions about whether people knew about annual health checks, how they found out about them, what their experiences were, and what would help or hinder them going. In total, we had 645 people respond to the survey, and 405 of those were based in the southwest, southeast, or London area. So this graph that you're looking at the moment shows who filled it in, and the figures shows actual numbers, not percentages. Over half of the responses came from people with a learning disability and or autism, or those answering the survey on their behalf. The majority of other respondents were from the health and social care workforce. We had 29 people from GPs or GP staff members respond to the survey, which made up 5% of the overall completion rate. And as I said, in the other category, we had commissioners from CCG and local authorities. We also had some nurses, social workers, and other types of commissioners. Next slide, please. So this one shows the majority, so this one is about the awareness and uptake. As I said, the survey was split up into a number of different versions. This are the answers from the people with learning disabilities and their carers who answered it. So it shows that the majority of people with a learning disability were aware to some extent of annual health checks, and there's quite an even split there between those who knew a lot about them and those who didn't know very much about them. And then just under a third, again, had never heard of annual health checks as well. So that's quite an interesting, even sort of three-way split there, which shows that there's some scope to do around raising awareness, which I'll come on to a little bit later on. The 9% who said that they wouldn't like an annual health check, when they asked why not, it was the fact that they regularly saw their doctor anyway, and that was quite a common reason for not attending a health check. Can I have the next slide, please? So this is the awareness and uptake from the health and social care workforce. As you can see here, it's very, very different to the previous slide, and by far the vast majority were fully aware of health checks. So that's 91% there, and then only a smaller percent, 6%, had heard about them but didn't know very much, and then fewer still saying that they had never heard of them. So that's quite a stark contrast to people with learning disability and their carers. Next slide, please. So this one is about the correspondence that people receive from GPs. This one is the answers from people with learning disabilities and their carers, and only a small number of respondents reported having received written correspondence from a GP regarding their health check, and over half have said that these were easy to understand, just over a third said that they were in easy read format. So you can see there that the 50% that hadn't received correspondence, there's probably a little bit of work to do there about having information that is accessible and easy to understand, which again I'm going to come on to a little bit later on. Have the next slide, please. So this one is about the experiences of having an annual health check, and these answers come from people with a learning disability and their carers. Nearly a quarter of those attending the annual health check did not get an action plan. Sorry, nearly three quarters did not get an action plan, or so they report. And of the 18 people that did get one, only 9%, so half of those said that the doctor had talked to them about what to put in the plan, and it, you know, went on for explanations. But the percentage there of people reporting that they did not get an annual health check is quite a high response. So we'll come into a little bit more of that later on. It could be that they might have got one, but it wasn't explained, or they didn't know what it was, or there's a variety of reasons, because we'll come on to a little bit later on how these results differ from different viewpoints. Next slide, please. So here you can see that the workforce are reporting, majority of the workforce are reporting that people do get an action plan. So 48% they said sometimes, and a quarter said always, and that's only 15% said that they never get one. So that is quite a stark contrast, as I was saying, to what people with learning disability or their families are reporting. So there's probably a bit of unpicking to do there to find out that why there's different levels of understanding there. Maybe it's of what an annual health or what an action plan is. Okay, next slide, please. So this one is about working with the GPs. This is some good examples here of partnership working with a GP provider from the workforce. So the majority of health and social care workers said that the GP always or sometimes worked with them to write up the action plan, and half said the GP always or sometimes gives the action plan and explains it to them. Around 2/5 said that the GP gives them the action plan but doesn't explain it. So while we're seeing a report here that there's a good uptake of action plans, it goes down slightly when we look at the explanation of the action plan that goes with it. So if we could move on to the next slide now, please. We can see here that this is the GP's report, that 87%, so you know, there's a vast majority there, are reporting that people attending annual health checks were given a health action plan. GPs reported on average in 2017-18 that 65% of their patients with a learning disability received a health check, and that went up to 69% in 2018-19. So that's the sort of percentage rates of people receiving annual health checks. Over 3/4 of the GP respondents said that they did send an easy read letter to people when inviting them to attend their health check, but only 1/3 of people with a learning disability said that they received the easy read letter. So again, some discrepancies there in what is being reported. Although, however, it's important to remember that it is a small percentage. This data from the GPs is a relatively small percentage compared to the rest of the data. Next slide, please. So this one is about supporting support and reasonable adjustments when we're going to an annual health check. So you can see the vast majority of those attending their annual health checks, that they were very well supported by someone that they knew and someone that they trusted. Most people reported that they felt comfortable. So 90% said that they were supported, as you can see on the slide there. And 78% of people also reported that they felt comfortable during the health check. Just under 2/3, 62%, said that the doctor explained everything clearly and that they fully understood what the doctor had told them. And only a small minority, 26%, said that they were offered help to complete an annual health check questionnaire. And only 10% said that the GP offered adjustments to help them attend their annual health check. So unfortunately, the majority of people, when asked if they needed anything changed, said that no, they weren't asked. So that's one of the significant findings there, which we'll do a roundup at the end. And can I have the next slide, please? So this one again is support and reasonable adjustments from the point of view of the health and social care workforce. So respondents were asked about how easy it was for the people they support to attend their health checks. And as you can see, the vast majority again agree that people will usually offer to support to attend an annual health check with someone that they know and trust. So there doesn't seem to be any issues in getting support for people to attend them. I think really, as you'll see, it's more about sort of the stuff before and after the annual health check, where there's probably a bit of work to do. However, so few agreed that it was usually easy to make an appointment. And only 39% agreed that people were usually offered support to complete a pre-health questionnaire. 41% agreed or strongly agreed that the GP usually explained the process, and then again there was sort of a similar sort of number disagreed. So it's sort of like a half and half there on that one. And then around half, or yeah, almost half, 49% of respondents disagreed that GPs made reasonable adjustments, unfortunately, for those people to attend annual health checks, and yet 36% actually agreed that they did make reasonable adjustments. And over half of the respondents said people usually feel comfortable during their annual health check. Can I have the next slide, please? So what does this generally tell us? So with the common themes there are that unfortunately there is quite poor communication was reported, and awareness from GPs. People with learning disabilities and their carers or gave some comments that there was poor communication. That GPs lack the communication skills to communicate effectively with people with learning disabilities. Others commented that GPs didn't really have a very good level of awareness of the annual health check and what needed to be included in it. So that was the whole thing around communication was quite a big issue. Fear and anxiety was quite a big factor, and this was cited by both people with learning disabilities and carers and health and social care staff as a reason for people not attending in their annual health check. Particularly with people that might have complex needs and challenging behaviours. So within that theme, it was clear that the thought of attending or even booking the health check really created some quite severe anxieties for people, and it just made it impossible for people to attend their annual health check. So that needs potentially looking into a little bit more. Some of the comments from people with learning disability included, "I'm not believed when I raise health concerns. There's never enough time, I'm not listened to. And this was from the carer, the person I care for lacks capacity and cannot communicate during their health check. The doctor or nurse did not help me to understand what was happening." That is a small sample, but these are just an example of some of the comments that we received back. And it was thought that the things that would help was support and encouragement for others would help to attend and encourage people to attend their annual health check more. And largely a better understanding of what the health check is about. So really more work needs to be done about raising the awareness of what an annual health check is, what will happen on a day, what will happen afterwards, what it is all about, the importance of it. So I think that's really where work needs to be done, is raising the awareness of what it is. And that information needs to be accessible. It needs to be accessible and available in easy read format more widely than currently. So there were mixed views on the ease of making appointments as well. That came back quite clearly. People with a learning disability and their carers felt that making an appointment was quite a challenge. That came through quite strongly. Felt that they couldn't get the appropriate time, or it was too far in the future, or they couldn't get through, or again, there was a lack of understanding. So they really felt that it was a challenge. However, the health and social care workforce reported far less issues when making an appointment. So that was one of the things that came through as more of a facilitator, actually, was getting the appointment booked by a family, or booked by the surgery themselves or by a carer. It really seemed to be quite a barrier for some people and not so much for others. The majority pointed out, and this is in the workforce as well, pointed out that people with learning disabilities don't know how to make the appointment, or maybe that they don't use a phone, or that they might forget it, or that they had experienced problems getting through to the GP on the phone. So they were the type of issues that people were reporting about what the barriers were. And some of the things that would help included some suggestions by such as home visits. Maybe it would be beneficial to have someone to come, particularly with someone with complex needs, to come and carry out the annual health check in someone's own home. Better communication was a a reason. A phone call as opposed to a letter, but then if people don't use a phone, that might be quite tricky in some instances, but it could be the preferred method for others. So I think just better, as I said, more accessible information in different formats is needed, and easy read documentation. Another suggestion was the quiet area to sit, or somewhere to quiet time to attend the appointments. Just make the environment quiet, more quiet and accessible, and more time for appointments. That was an important one as well. When asked what GPs could do to make it easier for the people to support, over 3/4 actually mentioned the home visit. So it was quite a large majority that people suggested that, or maybe in schools or other places where people with learning disabilities feel more comfortable. And also that whole preparation bit about helping people to understand more about what will happen at a health check and why they need one, and also sending out reminders with the time and the date was deemed as something quite useful as well. So some respondents did report some very positive experiences of attending annual health checks, such as it helped build trust around and build up a better relationship with GP and staff, and also it was vital for prevention, detection and reassurance for health problems. It helps monitor health conditions, identified health conditions that people didn't know they have, and just maintaining general health and well-being, and reviewing medication as well. So there were lots of benefits reported as well. Next slide, please. So what did we learn? Most people, certainly in the health and social care workforce, most people knew about annual health checks, and they learnt about them in these various ways, mostly from their internal systems. However, they would benefit from training of how to help people prepare. So it's about the stuff before the health check, so awareness raising with patients, invitations from GPs to make an appointment. Again, that better information, better awareness of what it's all about, the importance of it. And then at the health check, reasonable adjustments need to be made for the person with learning disability, and health checks need to work alongside hospital and other care services as well. And then after the health check, that follow up on the results, and then appropriate interventions being put in place if necessary. So there is areas obviously for improvement, as there always is, and we've identified quite a few of those from the survey results, and also more from the focus groups as well. And those focus groups allowed us to get a lot more in-depth understanding of what was going on out there. So we're going to hear about more of that in a moment. And so there is a huge amount of stuff that's going on out there that is working well. So I'd like to now pass over to Tricia, who's going to talk to you more a little bit about that. Thank you.
Oh, there we go. Going back into the room. Hi, everybody. Thanks ever so much for that, Christiana. So my section here is around kind of what we know that works. And I always kind of approach these sort of things with a real desire not to teach anybody's grandmother to suck any eggs, because in the over 500 people who are here, I'm sure there's a huge amount of fantastic practice that goes on. So I just wanted to pull a few bits and pieces together. I've been following the questions. I've been following the questions as well as doing my practical stuff about clicking the slides. There's a few bits around people asking about information about easy read, about multiple health checks, and about particularly around Mental Capacity Act. So if you've put a question around that, I'll try and pick some stuff up around that as I go on. So the really basic stuff, I guess, is that we know in terms of the annual health check, and I tend to think about the annual health check as a process, part of which is once a year a sort of marker in the sand about how things are now, but I like to think about it as a process that people go through that's about helping people get and stay healthy. So there's 4 bits that we know. We know that if you're going to have an annual health check, you need to know why you're having one. No, none of us are going to sign up to do anything we don't understand the reason why. People need to know that there's a right to a reasonable adjustment. And that's that, really such an important thing under the Equalities Act, that actually we can say this doesn't have to be done in a particular way. This has to be done in a way that works really well for me. I got a really nice example of that recently. My daughter had her check shortly before we went into lockdown, so probably towards the end of January. And I'm really lucky. I've got a fabulous practice who is getting to know us. We've not lived where we live very long, but it's getting to know us. But the appointment was sent through, and it was during college hours, and she certainly wouldn't be able to get her head around the fact that she wasn't going to go to college that day. That wouldn't be right. They didn't have annual health check evening appointments, but the nurse, the practice nurse, said that's fine. She can come to one of the Well Women evening appointments. What would be a good time? Second part of that was my Ella doesn't do waiting very well, or waiting around other human beings very well. So what we agreed was that she'd have the last appointment, and they actually agreed that they'd make the last appointment a little while after it should have been, so that hopefully the waiting room would be as absolutely quiet as possible. And we went along then, and there was agreement that we wouldn't sit in the waiting room at all, that we would go straight to the room in which the nurse would first of all meet her. So that was a really nice, worked really, really well. People also need to know what happens during a health check. You need to know why it's there, you need to know that it can work on your terms, and you need to know actually what are they going to do? What are they going to do to me? And then what may happen after a health check. That's why I think it's really important that we see the actual check as a marker in the sand and part of a planning process for how that person stays well or gets healthier. So there's a few resources I just wanted to kind of throw in there, and I by no means I'm sure there's somebody on the webinar going, but we've got some great stuff and you've not put it down. As part of this project, there'll be a huge list of resources and web links to things that we found out about. We haven't produced any resources. We haven't needed to. One of the things we've learned is that actually there's an awful lot of resources out there. In terms of particularly those of you who want to say to a GP practice who's telling you they don't know enough about what they've got to do, the Royal College of GPs have got a fabulous bit on their website, which is aimed at GPs intentionally, and literally, I've done a screenshot of it there, talks them through exactly what they need to do. So there's no reason why any GP shouldn't know what the deal is. It's there, it's from their organisation. I know we've got the Get Checked Out Leads Foca here. That's great. And this is just one thing I picked out in terms of the stuff that you've got, because you've got a whole bunch of great stuff. This was the kind of prep for an annual health check. And I'm just, again, flicking through the questions. Lynn, you'd put a question up about the preparation lists often seem to be focused at families or carers, and it's really, really important that actually the list, the kind of checking up, thinking about preparation for an annual health check obviously needs to be done with and by the person. And this is a really nice example of that. I know, Zan, you're on the call. Zan's the commissioner across over in Kent, and I've been doing a little bit of thinking and chatting with Zan and some folk over in Kent about what they're doing. Zan, please do type in the chat if I'm saying anything completely wrong. Particularly learning disability nurses working with GP practices to look at their register of people with learning disabilities and checking the right people are on it. Sam and I were talking about this earlier this morning. We had a bit of a Groundhog Day moment where she was remembering doing this work in excess of 10 years ago. But what you certainly found in Kent in the practices that you've been working with is that actually there were people who shouldn't have been on the list, and actually most of the practices that the learning disability nurses worked with were able to say to GPs, no, you don't need to have those people on your list, focus on these people. Again, the learning disability nurses working in partnership with GP practices and directly supporting and modelling, nurturing them to kind of do the annual health checks and make them really effective. And certainly that's had a really, really good impact. And provider organisations working with people to complete the pre-annual health check checklist. So again, and thinking about how as a provider organisation can you really make sure that people are as prepared as they possibly can be. Again, champions in Kent in the CCG in the integrated service and the alliance there for children and young people, so that GPs know they've got someone to talk to. Again, what they found in Kent, and I've heard this from other places, is that GPs were kind of not knowing what to do when something came up. So if they discovered something that was maybe condition related or something that they wanted to give the person more support around but wasn't their skill set, they didn't know where to go with that. So particularly for young people, and we know that you heard from the stats earlier on that the uptake is much worse in younger people, they're looking at having champions for children and young people in Kent. The other thing they've also got, and I met one of the practice partners last week, which was fab, Sharon. So 2 people with learning disabilities working for the partnership board, doing training and awareness raising around issues, and they work alongside broader learning disability champions in their services. And Kent have been working with providers to build their skills and confidence in preparing people. It's really, really critical that we give information in a way that works. You know, and I always say easy read as a concept is fine, but accessibility is in the eye of the beholder, and it's accessible to me if it's presented or produced in a way that works for me. Words, if words are a problem for you, then the best easy read might not work for you. So there are a few, and there's lots of them out there. I just picked a few. There's some interesting, a lovely film here by Inclusion Gloucestershire that covers about annual health checks. But there's something really important here for me about actually local areas working in partnership with their user-led and disabled people's user-led organisations and self-advocacy groups to actually work hand in hand with them to produce information, to share information, to look at the uptake. They're a huge resource to you. They need to be funded, but they're a huge resource to you in terms of reaching people. Another one, again, one by Somerset. And again, these are all include this. It's all learning disabled people themselves and autistic people actually interviewing people. And then there's a project that I'm sure lots of you know about that was commissioned by NHS England from Mencap, which is about films and guidance about health checks. Young people is a huge issue. One of the things that as part of this project we're hoping to get done before the end of the project is some work in London with young people, and we're going to be doing it virtually, work with young people, looking at the resources available to young people and helping young people become trainers and thinking about how they will help each other, encourage the uptake of annual health checks. So that will be part of hopefully we can get that done in time, that'll be part of the resources that come out of this project. There is a webinar, I've put one very specifically. If you go to Contact's website, there's quite a few bits of information. This is a particularly nice one again, GPs and annual health checks, Parent Voice co-presenting it, thinking again about what health checks are about, and particularly for families and young people who might not know much about them, that's there. So that's my bit done. Now this is where I get to hand over to, oh no, sorry, there was one more bit, sorry, I wanted to pick up on was the Mental Capacity Act stuff, sorry Sam. There's a few questions got typed in around people experience of, somebody, Sarah, you put very specifically that you heard about people told they can't have a health action plan if they're deemed to lack capacity. I think first of all, and I think Lynn, JJ, you've put some stuff up about lots of misunderstanding around capacity and the Capacity Act around annual health checks. I think you're absolutely right. So we've heard things like GPs being very reluctant to carry out physical examinations that they perceive to be that are invasive, but they are uncomfortable about whether or not someone's consenting. Also, right back in terms of the capacity issue. I think we all need to learn that line to reflect back to people when they talk about people lacking capacity. The capacity is in the moment and per decision, and the people don't generically lack capacity. So it's really important to reflect that back to people when they talk about lacking capacity. 100%, if there are things that you do not have the capacity to make in a particular moment, decisions you are not able to make in a particular moment, that does not mean that you cannot have a health action plan, categorically not. I hope that's helpful. Sam, over to you.
Hello, thank you, Tricia. One of the things that Tricia has said is that we probably know most of what we need to know, or there's loads and loads of brilliant resources out there. Many people are doing fantastic stuff that we found, and I guess through this project we just want to help try and connect and share so much of what you're doing. Anyway, and I know that Karen is on the webinar, and Roy, who worked across Wakefield, Calderdale, and Kirklees and Barnsley. I always forget the Barnsley bit. And did some really, came up with the same themes, so we know what we need to do. But one of the things I think we're all working out now is what's going on with annual health checks and COVID-19 and coronavirus. Can I have my next slide, please, Tricia? Thank you. So just to remind you all, annual health checks are a part of the critical services that we're expected to be restoring. And it's even more important, isn't it, that we remember that when we were told again this week that people with learning disabilities still die a lot younger than their non-disabled peers. And we know from the information we have so far that more people with learning disabilities died during the peak of the COVID first spike, or the March and April, than we might have expected. You know, it was disproportionate. So it feels even more important that we kind of understand how annual health checks can help tackle that and what we need to do. And NHS Primary Care Bulletin reminded everybody of that in May. Trish, go next slide, please. So there are some things that we think that we are learning that can help make this happen. So, you know, we are learning from you, from everybody, what it is that will help us work out how to keep health checks going. So, for example, who do you prioritise? Is it the people who missed last year's health check, those that are currently overdue, those with multiple or comorbidities, people in particularly risky situations? These are all things that can help us prioritise how you restart or maintain or grow the number of people getting a health check, particularly when we know that respiratory illnesses are such a worry for people. There's lots of examples of how people are thinking about how they help people prepare for the appointment. Trisha's talked about some of the ones that were pre-COVID-19 when we were in a different situation, but there's lots of examples I'll share in a second of how people are planning for that, doing it differently stuff. Next, please, Trisha. Thank you. So we know it's possible to do it remotely. We just wanted to share, and like I said, there's others, but we wanted to share some that were developed by young people, some young autistic people, developed Supercharge Me, which is an app and a website that's aimed about thinking about health remotely. And we know through COVID-19 that, you know, for some people there's been some really good changes, hasn't there? As well as some tricky stuff. And Christian shared his blog of how he had an annual health check during lockdown, and that's really worth looking at and thinking about what that means for people just thinking a bit creatively and a bit differently. Next slide, please. I saw in the chat that somebody asked about, are we linking up with NHS England? Yes, we're certainly talking to national team and regional teams and sharing what we can. But one of the things that we know is that in the reshaping and recovery plans, I don't know if they're called that at the moment, but CCGs and NHS trusts are being asked to particularly remember people with learning disabilities and annual health checks as one of the actions. Next slide, please. And the exemplars. So for those of you who don't know, NHS England are asking organisations in each region to act as trailblazers for helping to improve the number of health checks that are happening, and for that to be at least 75% in each area, and to try and help make sure that people get the flu jab and things like that. For those of you who were on and it hasn't, who might be part of an NHS organisation that might apply, we're putting the link in. You've got to apply, but please do. Tricia, please. And as I say, there are some examples of how people are adapting. So the Hertfordshire have developed a COVID-19 health check pathway and guide. The link is on the previous NHS England page that we linked to. It's really helpful because it just like other areas, helps you think through what do we need to change and what will trigger us to do everything remotely, to make sure we see this patient, to just do anything differently. What can we possibly do in different ways? It also helps with thinking about things like the capacity to consent to an online consultation, which we know is the kind of thing that feel like barriers for people. But actually, there are the solutions out there and the ways of working through this that colleagues are sharing very openly as we all work out whatever this new thing is. Next slide, please. Trish's already shared some of it, but Leeds have developed special easy read information on a phone consultation and health check guidelines under COVID. And Live Well in the Southwest are piloting a GP guide on health checks. So all of these will be in the resources we share, but they're just some of the examples. And if you've got something, then you know, please let us know. Next slide, please. So we have a project website that will be having all of this stuff in, that's got links to any resources that we find, to some case studies, some guides, some how-tos. But before I move on to that bit, I just want to check, Marie, are there any questions you think we need to answer live, or we could?
There are so many. so many that can't keep up with them. There's one that somebody might know the specific answer to. I think the answer is that about health checks for people who are autistic but don't have a learning disability. And the answer that I've given, to the best of my knowledge, is that Newcastle, there's a commitment to them. There's a project that Newcastle Uni is leading right now to research with people what their needs are and how they would work with them. And that if somebody at the minute feels that they need one, I think the best thing is to ask for a well woman, well man check and flag up that they're autistic. Mm-hmm. But then the follow-up question was, will they become a right, and what about autistic children? And I don't know the answer to that bit.
Okay, but we can go and find out. We've got them in the Q&A, and we'll go find out if we don't know immediately today.
Lots of people asking for links to templates and accessible stuff, but then lots of other people are putting those links in the chat, so we'll send them round to everyone. And just lots of questions along the lines of, we just can't get one, our GP says they haven't got time or space, and what do we do about that?
Could I pick up one? I think it was Vicky. I typed in the question box, I'll answer this, and I didn't answer it. And there's a few people have asked this about multiple checks. So if somebody has a learning disability and also has dementia, or has a learning disability and also has diabetes, you wouldn't, you know, do you have to have a dementia check and a diabetes check and an annual health check? That wouldn't make any sense in my life. So I would be talking to your GP very sensibly and saying, make the annual health check the focus, and make sure we pick up all those other things within the annual health check, using the relevant external expert professionals if that's necessary. So please, let's not do what I wouldn't want to do that in my life. So let's not make this happen for people. Let's not campaign for more different annual checks. Let's make sure the annual check is about life and all the elements of the life that you need sorting out.
Great, thank you. So, and there are some questions about what makes an acceptable level of check in the remote circumstances. And I know that there are some NHS England colleagues on the webinar today, so I'm not going to ask any of you, put you on the spot, but I think I understand there is work going on to clarify and support that. So as well as looking at sharing what local areas are developing, there is work going on that will kind of give some guidance and some clarity on that. I guess like lots of people, they're kind of catching up, I think. We will share it with you as attendees if you ask us for to keep in touch with you after today. So we are going to send you a link for a little bit of feedback, ask you what else might be useful, and if you sign up, we will then share with you everything that you send us. There will also be that project page that we mentioned earlier, and we will keep populating that, putting things in, and we want to do a little bit of a sell. If you are from London, the Southeast and the Southwest, one of our colleagues has done some amazingly exciting and impressive stuff with spreadsheets and data on annual health checks and GPs and things that, you know, if that's your thing. Unfortunately, because the project was focused on those areas, we don't have those clever whizzy tables for everywhere. But if you're in those areas, that might be one of the things you ask the project to share with you, or for a bit of follow-up. If you like a spreadsheet, they're impressive, you know. So I think that we have reached what we can do for today. We really hope it's been helpful. Please, please, please do give us a bit of feedback. It should come automatically via the place where you signed up, and we will try and answer any questions that we haven't been able to. We will, with a recording of today and the slides, send out any links or anything we can find out, because as we've said, this project for us was about trying to bring together the wisdom, the knowledge and the skill that we've all got between us. We certainly don't think that we are the people who know the most about annual health checks. We would not claim that. And if you've got anything you want to share with us and connect others to, we're really happy to. So thank you all very much for joining us. Thank you to Tricia and Christiana for their great presentations. And thank you to Marie for working so very, very hard on the chat. Other people will think that was the easy job, but it wasn't. I happen to know that. Thank you to all of you for joining us. Thank you.
Thank you.